Friends, simple things are difficult. Simple things are difficult, and very simple things are very difficult. Yes, this is what I learned in my childhood. That's what my grandfather used to say. My grandfather, he was giving sermons, or what is called in Marathi as pravachan, in temple. So I was small that time, around in third or fourth standard. So he used to take me along with him either in morning time or in evening time. And I used to sit in the front row. I used to get VIP treatment over there. Grandson of our Guruji. And then he used to tell people about God, about life, about how human beings should behave, and so many things. Now, one day, while returning, I asked my grandfather, I asked him, Grandpa, you are telling so many things, but they are so simple things. Why you are telling so simple things? How to talk, how to behave, and how to worship God, what God wants from people. These are so, what you are telling is simple things. Is there any need to tell? So my grandfather answered. He said, Anil, remember one thing. Simple things are the most difficult in life. Simple things are difficult to understand. Even if you understand, then those simple things will be difficult to implement in your life. Simple things, people need a push to adopt it. And that's why I'm telling them all simple things. I didn't understand much at that time. Even when I went to school, college, nothing much. But when I started dealing with patients, that time I realized the importance of teaching people these simple things, because simple things are really difficult to accept, and simple things are really difficult to follow, to adopt, to implement. And my friends, today I am in front of you to tell you few simple things about doctor-patient relationship, about medical practice, and how you can enhance your practice, how you can have happy relationship with your patient and become a happy doctor, prosperous doctor, and a successful doctor. So are you ready? If you are ready, then type I am R in the comment box. Or if you are watching this video on Facebook, then you don't forget to share this video with your contact, as well as keep on taking active part in your Facebook comments. If you are watching this video on YouTube, then don't forget to like and press the subscribe button and the bell icon, so that you get regular updates about Happy Doctor Foundation channel videos. And today you will see one of the most simple strategic example on how to have better practice. And I call it one game changer for your medical practice. Just one game changer. So we'll see it now and be with me. Thank you. Now I will share my screen with you. Okay. Since this is a live Zoom meeting, most of the time I will be spending in looking at the chats on the Zoom meeting and on screen sharing at different times. So we begin our journey to having a happy, successful, and prosperous practice by one game changer. Okay. I am sharing my screen with you. Okay. So now you will see this practice growth blueprint. Practice growth blueprint is the way to have successful, prosperous, and happy practice for doctor. In second column, you will see just knowing is not enough. You must apply this success principium to your thoughts. Practice growth blueprint says just knowing. Okay, many times we know everything. We know how to talk with the patient, we know how to operate, we know how to take post-op rounds, we know how to do dressing, we know how to give injections. Everybody knows, right? But only knowing is not enough. You must apply success principium to your practice. We'll see, because what I am going to show you is the basic infrastructure for your practice. And there are various levels. All my doctor friends who have joined Happy Doctor Foundation in my Telegram group and in my WhatsApp group, they have gone through this basic level. The basic level consists of this particular webinar and also value triangle success formula, 4 days WhatsApp course in which you get 6 videos and 1 live webinar. Many doctors, they have opted for advanced levels also. It's entirely up to you. But if you want to join our WhatsApp group and Telegram group, then you will find its link in the description area of this YouTube video. You can click on that and you can enter the community of Happy Doctor Foundation. Now we will see this practice growth blueprint. What are the various stages? See, now you will see here 3 main columns, 1, 2, and 3. In one column, first column, there are key concepts. So I will be making you aware of these key concepts. Please remember, doctors, I am not here to teach you anything. All of us are learned fellows. I am not here to teach you anything. I am here just to share my experience with you. And I am going to learn from your feedback. And that's why I need your feedback in comment box, on Facebook, as well as on YouTube or on Zoom chat. Because I have voracious appetite to learn. And I request you to give me feedback. So we'll see first key concept, then we will see strategy secrets, and last part is the prescription. So in key concept, what you are going to know about? Key concept will consist of finding your KYP, then reason for failure to thrive. All doctors are well versed with this terminology of failure to thrive. Failure to thrive means you are living, you are surviving, you are not dead, but you are not growing. Failure to thrive usually seen in pediatric group, right? And there are 20 causes. I remember in my medical education days, failure to thrive, one of my friends says, I know 15 causes. Second doctor, second medical student, my colleague will say, I know 18 causes. The other girl will come, she will say, I know 20 causes and I know 3 syndromes also. So much confusion and so many causes for failure to thrive. Failure to grow your practice, take it as a disease, and then we'll find out the prescription. Okay? Have this approach, have this attitude, change your mindset. So, we'll be finding out reason for failure to thrive in this particular webinar. This is an introduction to what you will be getting in live webinar. The link to live webinars will be sent to you on your email or Telegram group or WhatsApp group. And for that, you have to fill in the Google form or you have to click on our WikiAsep tool. Okay, all those links are there in the description. You just have to find time and click it. You might have to click about 3-4 links. Okay, it will take 4 seconds, not more than that. So take out 5 seconds from your busy time. Can you give me 5 seconds and click on these 4-5 links at no extra cost? Done? Okay. Then if you are ready for this, type done in comment box. So in key concept, we will be looking after your KYP, reason for failure to thrive, and simple solution. Just theoretical discussion. This is not an MBA class. This is not a management class. After my MCH plastic surgery from KM in 1990, I underwent PGDBA in brand management. And I know how management people are thinking. And what you are going to get from me is the amalgamation of medicine plus management. And whatever I will be telling you will be purely on ethical basis. So, key concept, your KYP, a reason for failure to thrive, and simple solutions we are going to find out. When we come to the strategy secrets, strategy means you have devised a plan for your future, what steps to take at what time and how to take it, how you are going to manage your practice. That is called as your strategy. And I am going to share strategy secrets with you, of which the first, as you are seeing in the screen, is the value triangle success formula. Value triangle success formula is the one game changer for your life, for your practice, for your success. Value triangle success formula aims at you as a doctor, your treatments, and your patient at the top. The result is HD equal to HP. So that means happy doctor equal to happy patient. Strategy secrets, what you are going to know is knowledge cycle. What is the cycle of your knowledge? You might have spent 10 years in medical practice or 50 years in medical practice. What is the cycle of your knowledge? That you must understand. Selecting your trump card. How to select your trump card when you are going to do your medical practice, that you will learn. And skill valuation. Skill valuation is entirely different thing. I remember during my MBBS days, I remember the name of the doctor, teacher who asked, Dr. Manu Kothari. Dr. Manu Kothari, he asked question, tell me who is most important in hospital. You know, we were confused. We said, sir, teacher, director. Dr. Manu Kothari said, patient. Patient is important. I am not your examiner. Patient is your examiner. Patient will pass you or fail you. And this particular thought is behind this skill valuation strategy secret. So that you will learn in Strategy Secret. Then prescription. What is the prescription? How to get out of this mess? That you are going to learn by patient acquisition strategy, patient acquisition formula, how to get the patients. And remember, without being unethical. Then how to be aware of fake people, fake unqualified or fake qualified people, how to be aware. And ultimate is your success principium. Success principium equals to M multiplied by MV plus MSG plus SW divided by FD. This is the formula for success principium. You will learn this in live webinar. So friends, you will be getting in your email box or Telegram or WhatsApp and or all trio the link for this helpful webinar. If you have time to look after yourself and look after your practice, then attend. If you don't have time, then do not attend. Don't just, when the live webinar is going on, suppose at 9:30 p.m., then don't just enter the webinar at 9:45, look at, how is the crowd and what is going, and then buzz off. Don't do like this. I want you to enter exactly at time when it is going to start and exit at the end of the webinar. It might last for 1 hour or 1.5 hours, depending on your questions and our interaction. So that much time out of your life, 1 hour, 1.5 hours, spend it. If you like it, if you want to adopt it, then you can jump in and stay with the inner circle of Happy Doctor Foundation. There are many doctors who have opted to have further top level interactions and learn the top level training from Happy Doctor Foundation, and they have become esteemed members of inner circle of Happy Doctor Foundation. Entirely up to you how you want to take the benefit of this practice growth blueprint. And yes, I'll be giving you free PDF of this practice growth blueprint at the end of the main webinar. And all these three concepts, the key concepts, secret strategy and prescription, the details, you will get the PDF mind map at the end of webinar. Those who have entered from 0 hours and they are there till end, they will get this mind map in their box at the end of the webinar. So friends, I once again thank you for taking out your time and being with me in this particular video. I just want one thing from you. I want you to like this video, because see, YouTube and Facebook, they have got their own algorithms. The more people like and more people share, then that particular video is shown to many doctors. So now whether you want all other doctors in India to see this particular video or no is entirely in your hand. You can flex your index finger on your mouse and click on like button, click on share button, click on bell button, so that many doctors get the benefit of this practice growth blueprint. It is entirely up to you whether you want to help other doctors. You are not at loss. There is no extra cost to you. That is my only one request. Once again, I thank you and hope to see you in our main webinar. So be in touch with Happy Doctor Foundation. Thank you. See you. Bye.